Is your esophagitis not improving despite GERD medicine? Imagine taking your medication every day, hoping your esophagitis will heal, but it just doesn't seem to get better. That can be frustrating, but there are reasons why this might happen. Esophagitis is inflammation of the esophagus, often caused by acid reflux in gastroesophageal reflux disease. When acid from the stomach flows back into the esophagus, it can damage the lining and cause symptoms like heartburn, chest pain, or difficulty swallowing. Most people with acid reflux take medications called proton pump inhibitors or histamine 2 receptor antagonists. These medicines work by reducing stomach acid, which helps heal the esophagus and relieving symptoms. But sometimes, even after several weeks of proper use, the inflammation doesn't improve. This can be confusing, but it's not uncommon. Up to 40% of patients might see only partial relief or no improvement at all. One reason could be how the medication is taken. Proton pump inhibitors should be taken about 30 to 60 minutes before a meal, usually in the morning. If they are taken incorrectly or missed doses happen, the medicine may not work as well. It's also important to stick with the treatment for at least 8 weeks before deciding if it's effective. Sometimes, people stop early or don't follow the instructions closely, which can delay healing. If after 8 weeks of proper medication the esophagitis still isn't healing, further tests are needed. An upper endoscopy allows a doctor to look directly at the esophagus and check the extent of inflammation. Sometimes, biopsies are taken to rule out other issues like eosinophilic esophagitis, which is an allergic condition that can mimic acid reflux. Additional tests like pH monitoring can measure how much acid reflux is happening even when you are on medication. Impedance testing can detect nonacid reflux, which might also cause symptoms. In some cases, symptoms persist because the reflux isn't just acid. It could be nonacidic reflux or reflux hypersensitivity, where the esophagus reacts strongly to normal amounts of reflux. When this happens, acid suppression alone might not be enough. Doctors may recommend other treatments, such as pain modulators, which are sometimes antidepressants that help reduce esophageal sensitivity. More severe esophagitis, like advanced grades or complications such as Barrett's esophagus, can also cause poor response to medication. For these situations, higher doses of proton pump inhibitors twice daily or even surgery might be necessary. Surgery options include procedures like fundoplication, which helps prevent reflux. In summary, if your esophagitis isn't improving despite GERD medicine, it's important to confirm you are taking the medication correctly and for the full recommended time. If not, adjustments can be made. If you have followed the instructions and still see no improvement, your doctor will likely recommend additional tests to find other causes or consider alternative treatments. Persistent esophagitis needs careful evaluation to find the best way to help your esophagus heal and your symptoms resolve.